So he can stay by himself um, the whole day or not?
No, he cannot. He always need to have somebody with him, watching him.
Or someone need to be with him all the time? So who is staying with him all the time?
At school, people watching him. At home, we're watching him.
Hmm. School is the same autism people like him. School is
Just like a daycare, adult daycare means like where the place where they keep the similar people like him in a different level, many different.
oh yes,
Yes, but that's all the people like disabilities.
nearby or how far?
Yes, around like 2 miles away from our house. Yes,
Or
close by.
are there how many autism like him?
At school, I think that over around 20, around
Yeah, about
20%
They
at
all
school.
disabled, different kind of disabled.
A different level.
Oh yes, men, boy or girls?
Yeah, they mean that they mix, but this is a place where they because like um they give us a choice. Either he has to be in a group home or he has to be in a daycare. So when they know that the parent has to be at work, so the government they offer the service that they take all these people like that to school. It's not a kind of school, a special school, specialist school though, so that they keep all the adult because like all is over 18 years old.
What about a caretaker that maybe comes to the house just to kind of take some of the weight
Yes,
off?
they do. They do have some special care, I mean, some special service that come to the house because the school they dismiss at 3 o'clock.
Mm.
And we're still at work. So
Oh
between
yeah, there
three
still
to
have to be
five,
like,
yeah, between 3 to 5, there's some caregiver that they can come over and then look after him until I came back from work.
That's nice.
So do you speak Vietnamese or
He,
English?
he speaks both, but
Both.
very little. I mean, he understands both.
Both.
Yeah, he can speak both, but yeah, but very little.
Does the caretaker stay at the house, or they take kind of
No,
take
just
them on
like
outings, like take
7
them to the
hours only.
park, or take them to?
Yeah, it means that they only take care while we was not at home. So they come
And as
and
soon as you get home, they leave.
yeah, they let yeah because they offer only like for example like 20 hours per week.
Per week.
Right. So we have to split it during the weeks. Um,
That's a bummer.
yeah, between like they came home around 3 to 5.
Sure.
Yeah, 5:30 when I get home and then they left.
And is there such thing as putting a request for them to be there longer? That way it kind of takes some of the weight and pressure off.
Because of the limit of time, so it has to be
Sure.
still within 20 hours.
And they're getting paid. It's probably
Of course, yeah, the government. This is the offer from the government that they offer. Yeah,
It's a whole
all kinds of disabilities like that.
Most of the autism are at the school are Vietnamese or
No,
Westerner.
no, they are American. They are different. Yeah,
Oh yeah.
they are mixed.
Most
Yeah.
of them American.
Oh yes. Is there a problem between the autism, Amanda autism problems or not?
What?
Amanda student.
Khi mà các bạn ở ở chung với tập thể nhau thì có vấn đề gì các bạn với nhau?
They get along well.
It depends. It's kind of you know like at school, it's just like kids. They see. It depends on what you considering as problem. There's no it's just like there's still minor problem because like a lot of people, but it's just minor. It's normal. But that's why they have a supervisor, they have a teacher, they have the right
So they like to go to school or dislike?
he himself or it
Yes.
depends. It depends on his mood.
Oh,
Someday he does, sometimes he doesn't. I don't know. It means that like I just mentioned earlier that like the morning procedure is sometimes is a nightmare. It depends what is his mood is. If he's in a good mood, he can follow the directions and it's easier. But sometimes he's not in a good mood. He had a tantrum and it takes like 3 or 4 hours the whole morning that my wife had to stay home because he doesn't simply need to try to persuade him to get into the car and go to school.
That's a lot of us, right?
Yeah, that's very frustrating. Yeah, it's very frustrating.
uh, what is the difference between he was young and older now? Any development with his autism? Is he developing or not? I mean,
Từ nhỏ đến lớn á, thì có cái sự phát triển gì trong tâm trí bạn
I
là có
I personally realized that it getting worse in some cases because like I mentioned like before, I do have some video clips that I keep in a certain for his like milestone of development. And I look back and I see that when he was 5 years old or 6 years old or 7 years old, his speech is very clear and he talked more. But like this is the kinds of cerebral palsy that the brain was damaged. So that's why it didn't grow, it didn't develop. So I realized that like his speech, his verbal is getting worse and worse. And right now is very slurring. Sometimes I and my wife can understand what he say because we know by gesture. So yes, but when you compare to when it was 5 or 6, I think that it get worse, and I think that's normal because the science they can explain about that one because your brain is dead in a certain area is dead, so there's no developing of the brain. So it's just like that. It stayed like that. I mean that like it's not influence on the motion, so he still can walk, but is affect on the intellectual. So it show like that. Then we have to accept it. But on the speech, verbally, I think that it's getting worse and worse.
Can I ask, is there any kind of like any way of like not challenging him, but like is there like any like kind of hardcore activities like maybe swimming, running, hiking,
Oh yes,
like
yes,
to really engage
yes.
him to
It means that like the fine motor skill is so bad. It means that like even like walking upstairs, downstairs, he need help. He need assistance.
it got worse?
Yeah, he
It's
cannot
been
swim.
like
He
that
doesn't know how to
always?
swim. Yeah,
It's been like that always.
yeah, right.
Sure.
mình chị Đức Kiều xin chia sẻ tiếp. Em nghĩ là chị có thể là tư vấn cái ca này tại là nó trong cái hiểu
um, how long they can be alive? How many years? I mean, can they be long lasting or not?
Say
experience. Normal person. Huh?
as a normal person, I think so.
And
We don't know. We don't know. We don't know because my concern, he didn't express how he feel. He never expressed. He never tell us where's the pain come from. So right now, because he's in at his age, there's no, I mean that like nothing wrong. But I think that when he aging, of course there will be something wrong with him. So that's my only concern. That like it's hard to tell because he didn't tell it exactly. He and even the I mean sorry the teacher, I just read the report that she sent it over home. She said that like it's about the speech therapist. She mentioned that like right now he pointed a lot. He do with lots of gesture instead of like verbal communication.
What about like did he have any hobbies like art, or he liked to paint, or
No,
'cause sometimes
no.
like art
His only hobby
Yeah.
is about playing toy, and the way he play is not as a normal child.
Sure. Because
You see that he's playing. He's just like you can
Yeah.
observe. He say that it,
sometimes like I'm sorry not to cut you off.
Yeah.
Hold that thought. I want to hear it. But sometimes like art therapy, a lot of times people that are in this position, maybe like red is a feeling, blue is a feeling, and there's certain people that are uh, very skilled in this kind of art therapy, and maybe they can use different mediums like art and things like that to try to help him express things that can't be communicated with how we communicate. He's got his own way, and in many ways, he could be like above us in many ways. It's just that our reality
Yeah.
and his reality, it clashes, and we don't understand.
I don't know, but he came to the state when he was 8,
Sure.
7 or 8. I don't remember
From
exactly, but
Viet-
he started.
from
He started.
Vietnam?
Yeah, from Vietnam, and he started got the occupational therapy, speech therapy,
Sure.
physical therapy. Started from that age until I think that like 18 until now. But the fact is that because sometimes that the therapist told me that like it's like that, it won't much approve unless they told me that like if he can if he should have done that earlier at the age of like 2 or 3, there might be a lot of improvement. But because he started getting all of that kinds of therapy like when he was 8, so they said it might too late, and
Yeah.
it is what it is. Yeah,
It is what it is.
right.
Yeah, unfortunately, sometimes in modern society, like, I have a friend who is like an acquaintance. He's like a therapist, and he really cares. His therapy is coming from the heart, and a lot of times, therapists and counselors, they like to bring up old trauma and make you relive it, because every time you go to their therapy session, you're paying them. So they want to keep you going to their sessions. And unfortunately, like you look at a lot of like psychotherapy, like, coming from like, it's like it's an institution, the Tavistock Clinic. You have people like Freud.
Right.
Yeah, anyways.
Right.
So not to get too deep and to trail off here, but maybe there is maybe like researching some sort of alternative therapy, like the art therapy, where he can, because it doesn't take much to like hold a brush and maybe express with colors, and maybe that can kind of, maybe that could lead to some sort of.
Right, right.
I'm just throwing it out there.
Yeah, yeah. I do believe because I heard a lot of like success on the like what they call early intervention.
Early intervention.
Right. But because I thought like, it might be too late for that one, so not much success.
Never too late.
Right. Yeah.
He cannot like do the art because the fine motor skill is bad. He cannot color. He cannot write. He cannot handle the pen.
And he also has attention deficit.
Sure.
He doesn't. He does never stay focused. He never sits still. He never do the same thing.
He can only do
Maybe-
it for a few seconds. He
Sure.
stop.
Oh, maybe attaching a brush somehow so he can kind of move the arm around, or maybe something like this. Or
Yeah.
We try to let him.
I'm an artist, so I just a lot of my personal therapy has came from me doing art by myself, and it's helped me. I know him and I are different in many ways, but
Yeah.
I feel like in many ways also that um, yeah, I think maybe sometimes unconventional ways can maybe you find something that does work if you keep maybe searching for if you have tried the conventional way over and over and there hasn't been some
Yeah.
success,
Yeah.
maybe I don't know, maybe is there such I'm sure there's such thing as like a thread board or message board where there's other people that have similar issues that you guys are facing, where people talk and they're like, hey, my son or daughter has the same issue, we tried this and it kind of worked out, or maybe is there any kind of like group that you guys are on or any kind of
We have like coordinators that she help us a lot.
Try you the online group.
I don't understand. I understand. No, we
like an
understand. I
online group
understand.
of other people who share the
I
same.
explain our situation that like we get this is our main resource. That like we collect a lot of information. We get help from her because she assign us what kinds of service or what kinds of things that like is good for her for him.
Yeah, it's
Yes,
benefit to
right,
yeah.
right. But right now is my because I try to accept what it is because the main thing is that like I realize I don't my expectation right now is very simple. I don't expect much about him, but what I think about the because I do realize that communication with him very important. I give you an example. He had two caregiver come to the house every day. Every minute they alternately take chance for that one.
Mhm.
But he loved the other one so much. He's so attached to one of the other.
Awesome.
Yeah, the reason very simple. If you observe that, you can see that because she talked with him. She
Yeah, she
communicate. Yeah,
engages with them.
she communicate with him not only about support him, but she sit and then she talk and watching. So there is a connection
Of
between
course.
him that's what I expect.
Yeah, of
Because
course,
like
of
if you
course.
have and that's why that's the only approach that I try
It
to get
doesn't
to
take a
him. Yeah,
genius,
right.
of course.
Because the more we engage, even ourselves also, we engage with him. We have time. We will
Sure.
get connection with him.
Sure.
However, we almost burned out. We exhausted at work. We came home. I left home around 6:30 in the morning. I came home 5:30, and then I go straight with him, the same as my wife. We take turn, and then she left around noon time
Mhm.
because she took him to school,
Sure.
and then right. But we both exhausted. We both burn out. So that's why I mean sometimes that like we need more energy. We need that's why we try to practice mindfulness. That's the only thing that can give us the strength, give us the energy to handle him.
Yeah, and I
Right.
guess the
Without that one, without
Right.
so I really appreciate what they tell it's like the master tell us
Yeah.
regarding about detachment. We all know about that one.
Sound
But
off
understanding and practicing is still a long way. It's still so much different.
But
That's why we now step by step we
Right.
try to do it. I all understand about attachment is the reason for suffering, but practicing for detachment is another thing. It is in reality that means that like you have to do it daily to get it more accustomed with that one. And like I mentioned this morning, this is the very first time for the last 10 years practicing mindfulness. This is the first time that we attend to the session like that.
Right. And the reality, the other side of the reality is you're not going to stop working. You got to pay the bills, and it's not like you're gonna kick
Exactly.
them out on the street,
Exactly.
you know?
Yeah. Right.
So you guys are, yeah, that's the other side of the. Yeah. And then also, the caregiver that was engaging with them.
Right.
She probably was a great person and actually cared
She
from the heart.
is. She
And
is.
maybe
Yeah.
sometimes that people go in that it's more of a job than actually care.
I'm so blessed to have her. Yeah, because if you observe and then you can detect, you can tell immediately that like he loves communication. He loves it like if you have one on one, especially one on one, and you will see the difference.
Okay.
If you spend time with him, you will see the difference.
Sure.
Yeah.
How about watching movie or
He loves kids movie, but
only kid?
yeah, only kids. But like Barney show, like something very funny, something like that. But the way he watched the movie is not normal. The kid, if you watch that, he has a phone so that he can watch YouTube or movies, something like that. But he never, his attention is has like short attention. He just like keep switching between. He never is watching the whole movie, nothing watching the whole thing. Rarely right now, I observe, I see there's some improvement that right now the longest clip that he can watch is around 3 minutes.
That's better than a lot of us.
Yeah. No, he doesn't know how to do that. It's only watching YouTube. He can watching YouTube all kinds of like kid channel.
Yeah. Yeah, yeah, it does.
So how about uh, his how about the autism like him? So if the parents pass away, well, is there any place for them?
Uh, we are so blessed that we live in the state that the
Yes.
government they cover a lot. So if you means that like whenever he turned 18, we had to go to the court to accept that because at the age of 18, yeah, it means that it's gone. No, I understand. I understand. I will explain more about that one. It means that like we have a choice either to give him to the group home or we will take care of him, and we decided to do that until yes we are unable because we are aging and we might pass away and something like that. Yes, that means that he has to join the group home. He has to go to the group home where the place that all the people like him living like this.
Or here in state, there are group
Yes, yes. The
for
government they offer the services.
yes, yeah.
Yes.
So you can let him stay at that place, is it?
Right.
Oh yes,
You can have a choice. You can
yes,
have a choice. Either we send him to the group home and or we can keep him stay home with you.
oh yes.
Right. That's the choice.
Is there such thing as like a sleepaway camp type of thing where maybe you guys can take the weekend off and have like a couple days to yourself?
Yeah, yeah, they do. They do
Oh,
offer like that. They do
that's good.
offer like
Yeah, that's good.
a weeks, like 1 or 2 weeks maximum
Like
per
a summer
year.
camp or something to
Right. They
give
can take care of that. Uh rarely. Yes, occasionally, like we. What
Like
was
I'm
the last
wondering
time?
if he misses you.
Right. Yes.
Does he miss
Yes. Yes. He missed us a lot.
Oh,
Yeah.
There's not some mechanics like some kind of foothold, but he can leave them shortly.
Temporarily.
1
Temporarily.
week, 2 weeks.
1 week, 2
Yeah,
weeks. So
yeah.
they will take care, like let him eat and like whatever he needs,
Yeah.
help him with toilet thing,
Yeah.
taking shower.
And then you guys go pick them back up after a couple weeks.
Yeah.
Yeah.
Well, that's great.
Yeah, like 2 weeks.
And you know that
2
like
weeks a year?
parents
That's it?
That's it.
Really?
either
That's not. That's nothing. 2 weeks. 2 weeks a year.
it's just like they
mean,
give
I
you a
just-
break because you voluntarily take. I mean, that like take care of him. They give you a choice. Either you put him into the group home
Sure.
so that like stay away from. You can come there and then visit him.
It's government funded.
Right, the government
I
funded.
see.
They take care of that. Or if you keep it his home, so they can like sometimes they release you for 2 weeks a year. So like you can have just a vacation for you.
Sure,
Because
yeah.
like it's a 24/7 job for him.
Right.
But we get helped a lot. Like daycare, the government they sponsor for that one, and after school, you know that like help us a lot. However, you know that like parents like us, is very difficult to handling because it's so stressed. If we don't know mindfulness, we don't know about detachment, something, a lot of pregnant in the parents like that. I just told Thủy, I share with her is like on Thursday before I take a day off, I have two couple come to my office and they gave up. The first couple that they separated because they cannot. It's too much stress for them to handle a severe disability child like him. So they decide to take a divorce. It just it's so sad to hear that one. And then the second couple they come to with the same thing that they they asked me because they want to help with the financially set up to put their child into the group home. It is also sad. I said, oh, I had two things at the same day that I had two clients come and then they gave up their child um, because of the stress that they cannot handle. So if you don't know how to handle well, I think that it's hard. It is really hard.
I think both me and my husband we know about Buddhism. So
Yes.
when we practice Buddhism, we accept. We learn how to accept what we have. Like before, I know Buddhism, like my life, I cannot like bear with that. It's too much. But like after I listen to the Buddha talk, so my life changed. I start to accept, so I feel like better and better and happier.
Yeah.
So
Yeah.
I
That's great.
my life is strong.
I remember when we started having qua with the situation like that, when we uncover that this one suicidal attempts happen to me all the time. I mean, that depression, and then I decided. It means many idea come to my mind that I decided like to jump into the river or something like that. It means that, but until we find out, I mean that the mindfulness, and we started practicing that one that helped us a lot.
Good.
Maybe Sierra, do you want like a quick summary or are you okay? Then even with the two choices that we have, like work based on Sierra answer question. Yeah.
So Seattle asked them, uh, what will happen to him if they pass away, or someone like him? And he said that there is, in the U.S. there is a group home, where people like him can stay, and or there's also a place he can stay temporarily, like, and they may bring him there like 2 weeks out of the year to take a break. Um, but that he misses them a lot during that time, and the father described that um, one day work together to take care of their child, and the second couple also wanted to put their child into the group home because they couldn't handle the stress. So it's a sad situation. But for them, they can practice mindfulness, and they learned the Buddha's teaching, so they have a way to handle it that those other couples didn't have. So basically, they have two choices. One is that the kid is staying home, and then someone is gonna come and take care of him when the parents go to work. And when the parents get back from work, then they can take care of the children themselves. And this is what they've been doing all the time. And the second option is to send him to a place where there will be people to take care of them. They call it
Group home. Yeah.
and that place is called a group home. But they decided to take care of the son by themselves. And the reason why they can keep helping him up to this point is because they practice meditation, practice mindfulness. It helped them with all of the stress that they have to endure when taking care of the son. Yes, so they learn to accept. And when they choose this option, uh, the government offered them 2 weeks to go away, and then someone else will take care of him for that 2 weeks, 2 weeks per year. Yes, that's why they mention when they go back, he misses them very much. So for the whole year, they take care of him by themselves. And then the government, they offers for each year, they have 2 weeks, 2 weeks off to go anywhere they want. And the people like the son will be taken care of for 2 weeks. So they just put him there for 2 weeks, and then they go away to reduce all of those stress, and then he will be taken care of by someone else, and they come back 2 weeks later to pick him up.
Also, they get help at which is paid by the government. Yes, that's what we take after that đi học. Đi học với em rồi thì chú có làm gì để tăng được chiều thì cái trường học 3 giờ vậy làm từ 3 giờ đến 5 giờ là được cái vẽ. Oh yes yes. Là bởi vì bạn đi học đến lớp tan lúc 3 giờ thì phải cần có người trong bạn từ 3 giờ đến 5 giờ mấy để chú về thay ca thì cái người đó là được trả về phủ luôn. Phải không ạ?
Yes.
Yeah, đó cái phần đó thì nếu mà có nói thì nói được không? Lúc mà bạn đi học thì là bạn đang học trường mà trường có 20 học sinh đó.
And then for the school that he's going to, the school ends at 3 p.m. So, but the thing is, he's gonna have to work until 5 p.m. So from 3 to 5, he have to hire someone to take care of the son. But the money is taken care by the government. Dạ chú, có nghĩa là ngay cả khi mà ví dụ mình được chính phủ hỗ trợ như vậy, ví dụ như là từ 3 giờ tới 5 giờ đi, thì những cái giờ còn lại là anh vẫn đi học. Còn cái option còn lại, cái group home còn lại là
Cái group home nó hoặc là nó permanently stay there thì là người ta cũng take care thì sẽ có cái service, there's a special service that they take care permanently, but he has to live in the group home. Yeah, a group home. But if we don't choose that option, the government they still offer like daycare, after school service, that kind of things that yes, it was sponsored by the government.
Cần làm rõ thì đi sẽ cần phải hiểu chính sách của bang của nước mình thì có cái đất nước cái
Yeah,
họ
yeah.
bang
of these ideas
theo
come into
này
come into this moment.
chương trình an sinh xã hội với các bệnh các bạn kia thầy cũng cần biết thêm về nước Mỹ.
Discovery of mindfulness is that reflection.
Seattle, do you need any clarification or information about the two options that he has?
Cái chế độ dành cho cái người này của cái bang này dành cho người tự kỷ của cái bang này.
Or like law and regulation concerned with autistic people like listen.
In general, like for
In
disability, for disabilities person.
By the expert. If you need any question, you can ask him more. He can give you about the service he in use.
What is the side effect for the group home for the disabled person? If they stay in that group home, what is the side effect?
Me personally, it's for me personally only. I think that like that's why we decide not to. Can you imagine that he is my own son, and sometimes I'm exhausted. Sometimes like I sometimes I got a feeling that I give up because I cannot offer a service to him. So if the same attitude, a same behavior like that, and do you think that if a caregiver, they don't have strong mind, they don't have compassion, they don't have enough compassion, they don't. Yeah, they just do for their job for money, and you know that it's very obvious about a lot of abuse in the group. It is on the papers every day. So that's the downside of that one. And I think that it's normal. It's normal because I got a feeling that this is my own son. But sometimes, like like, let me give. I'm so sorry to give you an example. Like during the night, sometimes that like he has to be put on a diaper, but that he intentionally take it off, and then he want to mess on the bed, so that he want attention, so that we have to take care of him. So he not do it accidentally, he did it on purpose. And then when you wake up and you see that one, it is your own son, and then you do that because you have compassion enough, you have your love is strong enough to do that. But if you think that like if you do it for money, and a lot of people, yes, I'm not talking about all of them, no. But if you don't have enough love, enough compassion to take that job, it is a very honored job that to do that. But like it's just like a nurse. It means that like if you don't have that kinds of like compassion or love enough, you cannot do that. That's the downside. That's what I say. That's the downside in the group home.
Yeah, because for group home, he has to stay there permanently.
And the group home, I think that like normally in one group home they have around 6 to 8 clients. They call their clients. Each one they don't call patient, they call their clients. So they have around like 6 to 7. It depends on the house and the facilities that they offer. It's just like a regular house, but they turn it into a group home. So they have like in one room they can share for 2 person or 1 person. It depends. But there's only one supervisor to take care of all 7 person like in this. So sometimes that's a lot, and that's why they cannot. We don't expect too much from them. Of course, they offer basic services. I'm very appreciative about their service, and it's understandable about what they offer, what they do. I think that it's normal. But like I say, that like sometimes like even I, this is for my own son, but I'm very frustrated. I'm very upset. It means that like when I realized that he did it on purpose, he did it intentionally. So
You understand the human factor.
that is correct. That is correct. So
the human
so that's normal. That's normal. But that's the downside for that one. I'm not talking all of them, but I'm just you imagine that it is just the normal thing happening.
Yeah, they don't have enough love and compassion.
Right. So that's why when you choose that job, you must have enough. The same thing with the two caregiver coming home. And if you see that that's a difference because the one that they love him, they just sit with him and then they talk with him, so there's a connection. But the other, they just come, they still very nice, she's still very nice, that's she did nothing wrong. But like if you look on the camera and you see that what she does, she just like looking at her phone. She do her, yeah, of course that like she did it, she keep watching him, don't let him do anything wrong, harmful. But That's it. That's it. Yeah, right. That's it. And she doesn't go above and beyond of what the expectation. She did what she yeah, that's her job. She did that point. But I don't blame her because like she did nothing wrong. But like whenever you do that, you must have first you must have a mindfulness practicing, and you must have a huge compassion.
I started Dhamma Hospital maybe from 2018, but I'm taking care of the patient from 2007 till now. I have experience of taking care all kinds of patient sickness for over 18 years. Uh, most of them are s- lonely. No one is taking care of them. They may have their relatives or family member, but uh, their family members uh, could not take care of the patient. That's why I allow uh, those kind of uh, lonely person in my meditation center. Every day there are one or two or three people uh, we are sending to this to our center from their from the charity group, from the village or from the town, from the hospital also. If there is not enough place in hospital, or if there is no need to do medication, they need some they need one place to send the patient for I use the power center for multi-purpose for every government and private organization. So taking care of the patient, we need volunteer. But if we don't have enough volunteer, we have to pay for the labor fee. So I have many experience concern this kind of abusing or problems. Uh, but one of the good point is there are more and more nursing trainee in the country. So most of the students will learn in different training course, but when they are practicing, they must come and stay in our meditation center because over 2,006 people are staying in our center. That's why we don't have enough volunteer. So many nursing students uh, come and stay in our center for practical taking care of the patient. They used to stay about 2 weeks or 3 weeks or 1 month. In this way, we are our problems concerned with the old and sick people are solving more than before. In the beginning, it will be like that. No, difficult to be patient, endure. That's why they are hitting or abusing to the patient. But in the long term, because of practicing meditation and doing good deeds more and more, there are less and less problem than before. I'm also facing with this kind of problem as a meditation teacher, as a leader of social activities. Therefore, I'm learning about the solution of the different country. I myself will create more and more Dhamma hospital. In Dhamma hospital, I can allow all kinds of old and sick people and mental patients, homeless, drug addicts. Therefore, but I use the power of Buddha, Dhamma, and Sangha. I use the power of teamwork. I use the power of detachment. That's why it will be better than other solution. Now you are taking care of yourself. This is good only for this life. Now, only for you are still alive. If you die, you will face problem. Your son will surely face problem. So this is also not the best solution. But because of not enough choice, you need to choose to take care of your son by yourself. I can learn a lot from you, from this country, so I can I can I can arrange better than before.
She's not in the picture to take care, to help.
She's stay away, no, get married. So it is okay for stop now, or you must go back.
Yes.
So please come tomorrow so we can I can teach more also to directly to your son.
Yeah. Okay. Yeah. Thank you. Thank you so much.
Yes. Yeah. Uh, meditation center, especially full-time meditation center, and helping doing all kinds of good deeds is really powerful, especially with the patient, with the autism like your son. They can feel better. We are solving this kind of problem. That's why um, for the needy people, uh, for the patient, for the old people, they can understand. Uh, they can feel the power, what they need. So that's why I'm teaching meditation and helping the most needy people of the society, like your son, for over 25 years continuously. That's why we can find better solution in the future. We will go Armstrong tomorrow also, so you can also, you should also follow to Armstrong. It will be uh, one of the best experience for him. Going Armstrong means going to the
đi khất thực ở bên không của Nam Trì nè. Dạ, chắc chú biết rồi đúng không ạ?
Có biết mà
Chúng ta sẽ xếp hàng,
xong
rồi quyết định sẽ đặt vé hoặc là đi theo để hỗ trợ, hoặc là chỉ đi theo thôi.
he can also donate like that. He can be donor to the monks and nuns like that.
Okay. Thank you.
Okay. Let's try. This is changing his mind, his life, to attach more on doing good deeds concerned with Buddha, Dhamma, and Sangha. It will make him to detach more, to be better. Not only for this life, but also for next life also.
YouTube teaching. Yes, so we can.
Yeah.
Dạ, con có hỏi là mình ngài có cái kênh YouTube á, thông qua quán live á, thì cô chú hoặc là cậu con trai cũng thể mở để xem và theo dõi.
Dạ, hồi sáng có thấy cái cô có nói chuyện với cái cô ở đây và cô có share cho cái YouTube kênh đó.
Các bài pháp ngài nói dạng cho bệnh nhân á, có thể nghe theo.
Okay.
There's also one comment in YouTube that is saying, I don't know what the boy was thinking, but he seemed very peaceful. Why don't we accept things as they are? Because who knows if he were normal as we want him to be.
Có một khán giả xem trực tuyến có để lại
Like I mentioned before, that's what I thought about the positive collective energy. That when he came here and then he can feel the peacefulness in here. He can feel the good energy in here so that he stay calmer. Because at home, if he get tantrum, it's a nightmare. He hurt himself, he bites himself, he throw things, it means like, it's not like that. So that's what I mentioned, that I do believe that it could be the energy from the master, the energy from the the group that can motivate him with that behavior.
Your collective mind.
Yes.
Our collective mind is stronger than his.
Exactly. Exactly. I do believe about this kinds of energy.
So how about open your Dhamma talk daily for him to listen?
Yes. You should open my teaching from YouTube. In this way,
I got it.
It will be helpful.
I got your channel.
Yes,
This morning I talked with one of the ladies. She gave it to me. Yes.
So good for you. You speak both languages. So whatever is said there, repeated again in English, then in Vietnamese.
Yeah.
If we can open the Ma Hospital or meditation center here for the patient, you should also come and stay, the whole family. In this way, you can understand what is the difference by staying at home and by staying in full-time meditation center.
I see. Yeah.
For it will be more development, especially for his mind. His mind change, his life can change.
That's my plan for retirement.
Yes,
Yeah,
yes.
I will. Yeah, that's my plan. And I'm looking for like a permanent meditation center.
Yes, that's good.
Yeah.
How what is your job?
I'm working in the bank.
Yes.
Yes, I'm a banker.
Oh. How old are you now?
I'm 60 years old.
Oh yes. You need to retire soon. Oh,
In the state, it has to be 67.
oh
Yeah,
yes.
7 more years. It's a long enough.
Mm. But it is better for your son to stay sooner to stay in the meditation center. Sooner is better. He can detach more in the meditation center like this.
I strongly believe about that. Yeah.
Mm.
Dắt nó đi em cứ dắt đi thầy nó tao nó cứ dắt nó đi nó bạn dắt cho nó ăn đi thầy vì thầy còn đang nói chuyện. Bạn kêu bằng đuốc nó ăn, bạn kêu bằng đuốc ăn.
Detachment therapy.
Không, dắt nó vô ăn đi. Thầy đang hỏi nhiều cái lắm rồi bên đây kia bạn dắt nó đi ăn đi.
Dạ đến giờ ăn tối ạ.
Dạ.
Waiting for dinner.
Oh,
Yes. Yeah, so you can ask the father more or teach some.